This is my venipuncture video. In order to start a venipuncture, I have to first verify with the provider's orders. I'm going to gather my necessary equipment and supplies. I'm going to perform hand hygiene and apply clean gloves. I am then going to introduce myself to the patient and their family. I'm going to close the curtain to provide patient's privacy, and I'm going to use two identifiers to identify the patient. I'm then going to use those identifiers against the MAR to clarify. I'm now going to prepare my insertion site. So I'm going to apply my tourniquet. I'm going to check for a distal pulse. I'm then going to grab an alcohol swab and clean my insertion site horizontally, vertically, and in a circular motion. While I allow that to dry, I'm going to grab my 22 gauge angio catheter. I'm going to hold my patient's skin taut. I'm going to inform them that they're going to feel a quick stick, and then I'm going to insert my IV at a 10 to 30 degree angle. Once I see a blood return, I'm going to put the IV flush to my patient's skin and advance my catheter. I'm going to apply pressure about an inch above the insertion site. I'm going to activate my safety and place that into the sharps container. I am then going to undo my tourniquet. I'm going to apply my saline lock. I'm going to undo the lock on the line, and then I'm going to insert saline to assure that my line is patent. Once I do that, I'm going to place my lock on the line. I'm going to undo my saline, and I'm going to apply my tegaderm. I'm going to initial my tegaderm according to my hospital's policies. And once my catheter is secure, I'm going to attach my IV line. I'm going to undo the lock. I'm going to slowly release the roller clamp, and I'm going to ensure that there is no swelling around my IV site. I'm now going to help the patient in a comfortable position, make sure that all their personal items and their call bell is within reach. I'm going to raise the appropriate number of side rails, and then I'm going to lower the bed in its lowest position. I'm going to dispose of all of my supplies and ensure that I leave the patient's room clean and tidy. I'm going to remove my gloves, dispose of them, and perform hand hygiene. And then I'm going to document and report the patient's response and the expected and unexpected outcomes.